The American College of Radiology no longer supports or endorses the use of gradient shields for imaging exams because they are no longer considered sufficiently effective and represent a psychological issue for patients who undergo these procedures. Today, in modern medical practice, when you tell a patient that you are using this type of shield during their exam process, they might argue with you vehemently, as they now have developed an understanding or concept that suggests to them you may be neglecting their rights in some way, which could lead them to become confrontational about it altogether. However, this particular issue does not provide any real protection whatsoever. For instance, if someone happens to be pregnant and comes into your facility seeking a CT scan specifically targeting her pelvic region only, then discovers she is indeed pregnant after all tests have been conducted thoroughly, she might ask questions such as, "What should we do next, doctor? Should we consider abortion options available at our disposal currently, or what exactly would be deemed an appropriate solution under these circumstances?" You need carefully assess whether she falls above 0.1 threshold level, medically speaking, or not necessarily so. The attending doctor might say something along lines like, "Look here closely, please. She will definitely exceed 0.1 threshold without doubt," implying quite clearly enough, already mentioned earlier on, that dose about receive selected dose me.
Okay, what about terminations? All right.
I have terminates. Can you explain my termination? Yes, 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 yes. Yes, yes, yes. Yes, 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 yes. The ICRB 84 is the reference you should read if you want to learn about pregnancy and breastfeeding. The ICRB 84 provides recommendations for performing termination. I told you that nootropium should be administered if the dose is less than 100 milligrams. The first action that must be taken is that the dose needs to be improved. The dose must be improved. That's number one. The dose must be improved, okay? We calculated the dose and it was fine. Now, if the dose is between 100 and 500 milligrams, the matter depends on the individual. The circumstances regarding the patient's culture and religion will determine whether they will accept this or not. The discussion here will depend on the individual themselves. When will this happen? We are talking about exceeding the limit, which is largely dependent on exceeding the 100 milligram threshold, and this is significantly influenced by the stage of pregnancy. You need to consider at which stage of pregnancy you are. Therefore, the dose calculation must be reassessed. As for guidelines, in our radiological procedures, we use less than 100 milligram. I don't think it will exceed that. It will be very rare unless we are using it for something specific. There were even some questions asking if I have a patient who is pregnant and needs to undergo fluoroscopy, should I proceed or not? If here it is dealing, I see even in the angle of the tube. For example, I try to choose or select in a way that keeps it as far away as possible from that area. Everything can help in reducing the radiation dose, right? As we said, the issue depends on the dose and the stage of pregnancy. The initial period from 0 to 2 weeks, as we mentioned, is all or none. The organogenesis period lasts from the 3rd week to the 8th week. This is what we may encounter when we talk about mere formation. After that, factors causing mental retardation arise from the 8th to 15th week. A 50 millisieverts dose. 15 weeks post-conception affects delivery. Okay, here is the dose that could cause, for example, you have here, for example, is the dose that could cause it, yes. Here, the topic of the main formation is related to organogenesis. It is considered that cell resistance can undergo correction in any dysgenesis. However, as I mentioned, this stage is the first organ, and after that, organogenesis occurs, which is in the 3rd week. you need a dose of 250 millisieverts or more for the main formation to occur, or between 200 to 500 for growth retardation. The vital period, which is from the 8th to the 15th week, is when the central nervous system is the most sensitive. Here, the IQ can decrease by 30 points per sievert if your dose is greater than 300 millisieverts. So, the topic is shifting between millisieverts and milligray. When you come to millisieverts, is this the effective dose or the equivalent dose? Effective dose is important here because you are dealing with the dose that the fetus itself is exposed to. So, when I say I have a pregnant case that was exposed to 100 milligray, it means that the fetus was exposed to 100 milligray. Now, if I said the whole body was exposed to 100 milligray, you multiply by the weighting factor to get the fetus dose or the pelvic area, for example. Okay? So, this is mentioned in the guidelines, or in what they tell you, which is the 0.1 gray or the 100 milligray. This is the 3 threshold. You are dealing with the dose here. Whose dose? The dose for the whole body, or the dose for the child? The whole body. The whole body dose is fine. Here you are dealing with absorbed dose, not effective dose. When it comes to CRP 84, the 100 milligray Hadis dose refers to the whole body, not the child itself. So, the whole body dose for the pregnant individual is the 100 milligray. However, when I talk about millisieverts, I am referring to the fetal dose, not the whole body dose. Regarding X-rays and gamma rays, when I talk about the whole body dose or the absorbed dose, it is the same as the effective dose. For example, if a pregnant person is exposed to 100 milligray, I can remove the milligray and put millisievert, but there is a problem. In this case, you are talking about the whole body, but when it comes to indicating the dose in milligray, you cannot specify a certain dose. Therefore, you must talk about the effective dose. Do I have a doctor with me? I have all the dose limits we are talking about because they are measured for the whole body, meaning all dose limits for milligray apply to the entire body. So when I talked about deterministic effects, what was I discussing? When I came here, I was talking about whole body exposure. So you are talking, for example, about milligray. Now, when you talk about a specific organ, it talks about whether to use the cybert or the rosebud. And as I told you, if we are talking about X-ray and gamma, your value is the same whether in milligray or millisievert. My question, doctor, is if a case comes in, for example, someone in a critical condition. Let's say she is in critical condition and needs a CT scan because that is usually the solution. Did she justify it? Is there another examination that can solve the issue? There is no other option. Just do it. It won't shorten her life. Shorten her. But it is necessary to obtain consent, of course, from her or someone from her family if she is conscious. But it will definitely be someone from her family. At that moment, you are saving her life 1,000,000 times more than the dose. And at the same time, you are optimizing the procedure. For example, if I am currently working on a CT scan of the pelvis, while I am working, I use the lowest available parameters, the lowest quality, the lowest milliamperes. I speed up the table movement. Increase the rotation time to make it fast, and minimize the scan time as much as possible. In this case, you have optimized the procedure, thus reducing the radiation dose. Of course, you then check the DLB in the area of interest and multiply it by the weighting factor for that area to get the effective dose for that region. Okay? Okay? In fluoroscopy, the distribution of the dose is such that if I place the X-ray tube under the couch and my image intensifier above the patient, the main source of radiation from this procedure is always the patient. The problem that interventional radiologists face during the procedure is that they are exposed to scattered radiation, particularly in the area below, where they are exposed to a very high dose of backscattered radiation, which is approximately 2 to 3 times the dose they receive. The scattered radiation represents about 0.1% of the entrance dose that the patient receives. If the X-ray tube is placed under the couch in this manner, all scattered radiation will be directed downwards, right? There is some scattered radiation directed upwards and some directed sideways as well. The highest amount of scattered radiation is backscattered radiation, and there is a portion of radiation that is stopped and a portion that is scattered in general. The highest values, the highest amount of scattered radiation is the backscattered radiation. This value, when facing the area, why is it not better, or does it remain mine? It would be better if it were fine. So, do I now have this and stand on my side? By God, I stand on the side of Inspire. By God, on the side of the X-ray tube. Because there is high scatter here, if I stand here, I will be exposed to high radiation, or someone from the staff with me. So, it is better for me to stay next to the image intensifier. All of these are measures during the procedure to protect the staff from radiation exposure. This represents the scatter. Here is the X-ray tube, and this is the image intensifier, and this is the scattered radiation. If you place the X-ray tube over the couch like this, all the scattered radiation is directed towards the sensitive organs located here, unlike when it is under the couch, where the scattered radiation is all coming from below. Here, it represents the distribution you might be exposed to, for example, in any area within a range of 0.5 to 2.5 millisieverts per hour dose rate, and here from 1.1 to 5 millisieverts, and here 2 to 10 millisieverts per hour if you are operating the X-ray tube under the couch. Now, let's see together the effect of something called a suspended sealing screen, which is present during the fluoroscopy procedure. I want to assess the impact or efficiency of those moving elements that are being introduced, both in their presence and absence, on irradiation or scattered radiation affecting the worker present. So, the part that I have is the one above, which is the screen that the image is displayed on, and this is the dose related to it. This part is crucial for the overall functionality of the system, ensuring that the image is accurately and clearly displayed on the screen. There is no dose for us, for example, that was reaching. In the case when it was placed, it dropped to 46 microsieverts, and when it was removed, it reached 1 millisievert. So this is a type of using the sealing shield, which is fixed and movable, protecting the operator from scattered radiation. Here is the screen. You see what it burns, doctor. This part, or you see what was removed, here. They move it, doctor. This part. I see. There's something with the person standing there. Okay, it starts measuring the dose. In the case of not using the shielding, or here for example, you will find the dose that reached here. Look if it reached about 46 or 47 microsieverts, or 50. So, when it was removed, if the shielding was removed, you will find that it reached 1 millisievert. So here you have the efficiency of the shielding again. Okay.
No, Your Honor, it's not enough for me today or anything because you're tired.
Okay, God willing, we will continue. This part, God willing, next time.
Okay, is this concept clear or are there problems? The concept is clear. So, what is the relationship? Sorry, everyone, but this is the last question. What is the relationship between the exposure dose, which is related to Roentgen, and the absorbed dose? What is the relationship between them? Is there a factor, for example, that converts them? Ah, of course, you can convert Roentgen to absorbed dose.
It's very normal. There is a certain factor that relates how many Roentgens equal how much absorbed dose. I can show you next time in the equation. You can determine the absorbed dose if you have a survey meter and want to know how much absorbed dose someone standing here would receive. You can convert from that. This is a factor, meaning these are fixed values. 0.87. Okay, doctors. All right. Thank you, Mr. Reitke. When I start, I will remove your clothes? Sure. I just need to arrange a few things, and I will send it to you, God willing. These are all the updated visualizations, because they didn't mention that the updated designs take the 2017 data. They had sent the last thing, which is from 2017. I went back a bit. Do you have the source book with you? They are available. The first 100. Hello, honey. They are exploring. We are in the lectures. I found the latest things from 2017. Is that correct? Yes, that's supposed to be cloney, but what about you? I wish. If you don't mind, please also take a look and see if there's any tension or anything else. I will inform you. Okay, thank you. Peace be upon you. Thank you. Peace be upon you.